Hi, I'm Amy Lancaster. I'm a HealthWorks physical therapist and certified athletic trainer, and also the director of our HealthWorks Westover clinic. Today, Jake and I are going to be going over a couple exercises that we commonly will prescribe to patients with general complaints of a stiff neck or maybe some neck pain. So the first one, easy to do at home. All you're going to need is just a bath towel, okay? And what I'm going to do is just kind of roll this up. I'm going to instruct Jake to kind of wrap this around his neck and cross here. And Jake, if you want to just hold that. Now, what we're going to do, very gently, this is going to support your neck and make it a little less painful. I want you to just duck your head down forward, bring it back up, nice and easy. Now you're going to take your left ear down towards your left shoulder. Just hold for a couple seconds, a nice slow movement. Come back up to midline. Nice and easy, you're going to look up towards the ceiling. Again, just a couple seconds here, and then you're going to come down and bring your right ear towards right shoulder. And we usually do this in a sequence of 4 movements here, and I'd have typically patients going through this maybe 3 to 5 times, maybe first thing in the morning, just to kind of loosen up their neck. Now, you'll find that at some point, Jake, this is going to get pretty easy and that we don't need the help with the towel anymore, so we're going to progress. So at this point, we remove the towel. Now, the next 2 exercises we're looking at, we call them 3 to 4 finger rotation and side bending. So Jake, what I'm going to have you do, take your hand, all right, with 4 fingers. I want you to stick them right there on your chest bone and just duck your head down so that your chin is resting. And that's going to just open up your neck and put you into a nice position for movement. Now, what I'm going to have you do very gently is we're going to, once again, do our side bending maneuver where you're going to just go down to the right side, hold about 3 to 5 seconds, come back up to midline, and then going down to the left. And again, typically we're going to be going through this exercise about 3 to 5 times just for some general movement. Once we have achieved that, the next thing, similar position, Jake, but what you're going to do is instead of side bending, I'm going to have you actually rotating your neck like you're turning and looking over your shoulder. Same thing, about 3 to 5 seconds, and then rotating off to the other side. Good. And at this point, another thing you can do, Jake, as you're finding that your neck is moving better, you can actually start removing fingers. So we started today with 4, and you're going to find as you actually gain range of motion that you're going to be able to kind of remove a finger all the way getting down to about 2 fingers for that same exercise. Okay? And like I said, that's just a nice starting point for some cervical mobility exercises.